1. Which of the following best describes the main purpose of HIPAA? To ensure medical facilities operate profitably. B. To protect the privacy and security of patient health information. C. To manage insurance premiums across healthcare providers. D. To standardize billing procedures among hospitals. 2. Under HIPAA, which type of information is considered protected health information? A. General demographic data without identifiers. B. Any data that can identify an individual and relates to their health condition. C. Aggregated public health data. D. Anonymous survey responses. 3. Which of the following is a required component of HIPAA compliance training for employees? A. Medical diagnosis procedures. B. Patient billing system management. C. Safeguarding of patient information. D. Marketing strategies for healthcare services. 4. When developing HIPAA training content, what adult learning principle should be emphasized? A. Passive memorization. B. Immediate applicability of knowledge. C. Rote repetition of legal terms. D. Group competition. 5. A nurse accidentally discloses patient data to an unauthorized coworker. What kind of HIPAA violation has occurred? A. Security violation. Privacy violation. C. Breach of integrity. D. Administrative violation. 6. What is the primary purpose of a business associate agreement under HIPAA? To define financial compensation for third parties. B. To ensure third parties protect PHI they access. C. To provide liability insurance for covered entities. D. To manage contract termination terms. 7. HIPAA's security rule primarily focuses on which of the following? A. Technical and administrative safeguards for electronic PHI. B. Ethical standards for patient interaction. C. Licensing of healthcare professionals. D. Medical malpractice regulations. 8. Which of the following is a valid example of PHI under HIPAA? A. A patient's zip code alone. B. De-identified patient survey results. C. A patient's medical record number. D. Hospital statistics without names. 9. A covered entity must notify affected individuals of a data breach within how many days of discovery? A. 10 days. B. 30 days. C. 60 days. D. 90 days. 10. Which of the following best defines minimum necessary standard in HIPAA? A. Using the least amount of data needed to perform a job function. B. Allowing access to all patient data for efficiency. C. Restricting all data access to supervisors only. D. Deleting unnecessary data after each transaction. 11. The Office for Civil Rights, OCR, is responsible for what under HIPAA? A. Issuing medical licenses. B. Enforcing HIPAA compliance and handling complaints. C. Managing healthcare marketing. D. Providing malpractice insurance. 12. A HIPAA training program should include which evaluation method to ensure learner retention? Peer voting. B. Scenario-based assessments. C. Essay submissions. D. Unstructured discussion. 13. Which of the following is an example of a technical safeguard under HIPAA? A. Implementing firewall protection. B. Assigning confidentiality agreements. C. Creating a code of conduct. D. Providing HIPAA awareness posters. 14. When mentoring new staff about HIPAA, a best practice is to A. Use real case studies of breaches to emphasize importance. B. Read the entire HIPAA law verbatim. C. Skip assessments for experienced staff. D. Focus only on administrative requirements. 15. Which is not a covered entity under HIPAA? A. Healthcare providers. B. Health insurance companies. C. Healthcare clearinghouses. D. Life insurance agencies. 16. When designing HIPAA compliance curricula, which factor enhances adult engagement? A. Abstract theory discussion. B. Real-life application scenarios. C. Long legal readings. Standardized testing. 17. What is the main goal of encryption in HIPAA compliance? A. To increase data transfer speed. B. To reduce storage costs. C. To protect electronic PHI from unauthorized access. D. To simplify user logins. 18. Which of the following would be considered a HIPAA breach? A. Sharing PHI with an authorized provider. B. Using PHI for patient treatment purposes. C. Leaving patient files open on a shared computer. D. Discussing care with the patient's designated representative. 19. In the context of HIPAA, the term covered entity includes A. Healthcare providers transmitting health information. B. Medical equipment manufacturers. C. Pharmaceutical researchers. D. Government health departments. 20. Which document defines the permissible uses and disclosures of PHI? A. Security manual. B. Privacy policy. C. Data processing agreement. D. Business ethics code. 21. A HIPAA-compliant organization should conduct risk analyses. A. Once every 5 years. B. Only after a data breach. C. Regularly to identify and mitigate potential vulnerabilities. D. When new employees are hired. 22. Which of the following scenarios best reflects compliance with HIPAA's right of access rule? A. Denying a patient's request for their own records. B. Providing patient records within 30 days upon request. C. Charging excessive fees for record copies. D. Requiring court approval for release of records. 23. HIPAA training should be repeated. A. Once per employee career. Only after policy changes. C. Annually or as necessary when procedures change. D. Every 5 years. 24. What is an example of a physical safeguard under HIPAA? A. Password protection. B. Locking filing cabinets containing PHI. C. Data encryption. Audit controls. 25. The HIPAA privacy rule governs a handling of all forms of PHI, only paper-based PI. D. Medical device data. 26. An organization found in violation of HIPAA could face A. Community service. B. Civil and criminal penalties. C. License revocation only. Verbal warnings. 27. Which of the following is a permissible disclosure without patient authorization? A. Sharing information with a friend. B. Reporting infectious diseases to public health authorities. C. Selling data to third parties. D. Publishing medical case studies. 28. When a breach affects more than 500 individuals, it must be reported to A. The local police. Media and HHS. C. The state insurance department. D. The hospital administrator only. 29. What is the primary benefit of HIPAA training assessments? A. To penalize employees for mistakes. B. To measure understanding and reinforce key practices. C. To reduce documentation requirements. To replace formal certification exams. 30. The term de-identified information means A. FI stripped of identifiers that could trace to an individual. B. Any data collected by third parties. C. Information shared within hospitals. D. Medical records sent to billing departments. 31. A patient's consent is required for which of the following? A. Treatment-related communication. B. Payment processing. C. Use of PHI for marketing purposes. D. Sharing PHI with other providers. 32. Under HIPAA, what should be done if an employee suspects a data breach? A. Ignore it until verified. B. Immediately report it to the compliance officer. C. Delete related data. D. Inform the patient directly. 33. HIPAA promotes mentoring effectiveness when mentors A. Model ethical data handling and confidentiality. B. Avoid giving real-world examples. C. Focus on unrelated leadership skills. D. Skip data protection topics. 34. The security rule covers all of the following, except A. Administrative safeguards. B. Physical safeguards. C. Technical safeguards. D. Marketing regulations. 35. When documenting HIPAA compliance, which evidence is most effective? A. Attendance sheets only. B. Signed confidentiality acknowledgments and training records. C. Verbal confirmations. D. Anonymous surveys. 36. The right to amend under HIPAA allows patients to A. Change any record without review. B. Request corrections to their medical information. Erase past records. D. Hide sensitive diagnoses. 37. An effective HIPAA mentor should A. Provide constructive feedback on privacy practices. B. Avoid follow-up sessions. C. Focus only on theoretical discussions. Discourage questions. 38. Which is not an example of PHI under HIPAA? A. Medical record number. B. Social security number. C. Zip code without identifiers. D. Patient's email address. 39. If a physician discusses a patient's case in a public elevator, it violates, right? A. Privacy rule. B. Security rule. C. Integrity rule. D. Retention rule.